Hi everyone, this is your program manager Ellen. Welcome to our fitness assessment demo. We are going to be getting our post-assessment measurements after our holiday hold down program. So all you need for today is a tape measure, a pen, and some paper. And ideally, also the measurements that you got before our program started. We did those measurements, the initial pre-assessment, it was November 17th. So we're doing this almost two months later, which is great. So we're doing it the same day, same time of day. So we try to keep those factors the same. I'm wearing almost the same exact outfit that I did my pre-assessment measurements in. So we also want to try to keep that the same as well. So we're just going to focus on circumference measurements. And later on in the month of February, we're actually going to do some different types of assessments for cardiovascular endurance, muscular strength and endurance, and flexibility, because February is American Heart Month. So let's go ahead and get started. And you ideally want this type of tape measure. Last time we did this, I actually had a different type of tape measure that wasn't flat, but it was all that I had at the time. And now I've gotten myself real tape measure. This is ideally what you want. And our first area that we're going to measure, everything is in inches. Our first area is the neck. So I'm going to go ahead and get this started. All of our measurements will be loaded onto your profile on PT Minder. So when you're done doing those, you can just send them to me and I'll upload them for you. So when you're using this type of measurement, you just want to sort of make a crisscross. And that's how you'll know where to do your reading. So I'm going to place my finger there. This one's a little bit trickier to pull it off. And I'm going to go ahead and write that down. And again, everything is in inches. Okay, our next measurement is the chest. So this is the widest area of our chest here. I'm going to go ahead and slide this under and around and get this measurement as well. So again, you can do that little crisscross, and then right where the X hits, we're going to place your finger and where you will actually make that measurement and get that reading. Okay, so we're going to write that down. And even if you didn't do our holiday hold down program, measurements are great to do, especially since we're still at home. We can't have someone else doing them. So it's important for you to learn that skill. Okay, our next one is going to be arm. So this is the widest part of our arm. I'm going to roll up my sleeve here. So the widest part, we're going to do the right and the left side, because there can sometimes be a difference. So we want to do both. Another thing that I didn't mention at the beginning of this program a couple months ago was actually taking before and after photos. So if you have a goal, a very specific goal that you're working towards, and it's specifically related to like weight loss or weight gain, you can also take photos of yourself before and after. That number on the scale is going to fluctuate and it's not very accurate, but seeing photos of yourself can also be really helpful, especially if you don't want to do measurements or you don't have a measuring tape. All right, so that was my left arm. So now I'm going to do my right. Same thing. I know on the screen for you it's left, but this is my right side. Okay, widest part. And again, it doesn't have to be perfect or completely exact, but ideally in a similar way that you did these in the very beginning of the program. And if you're just doing them for the first time, make note of what you're wearing, what time of day it is, because ideally you want to do it around the same time, whether it's before or after a workout, just keeping those factors and conditions the same, and make sure you have all that written down. So write this down. Okay. And of course you'd want ideally sort of not super loose fitting, but fitness attire so you can get to those places and not have really baggy clothes, especially for our waist and hip measurement, which is actually going to be next. So our waist, even though this might sound or feel funny when we do it, it's actually right above the belly button. So you're going to find that belly button is about an inch above. It's the narrowest part of your body. So even though we might not wear our pants that high, that is actually your waist. So this is where you don't want to have a really baggy shirt, something a little more form-fitting. And if you do have a baggy shirt, just pull on the tape a little bit to make sure you get as accurate as possible. All right, here we go. Perfect, so that's the waist. And then we're gonna do the hips, which is the widest part, okay? Widest part around the body. This is where you ideally wanna have form-fitting tight pants to get that measurement. So I'm gonna wrap it around, okay? Wrap it around, widest part. And on Zoom, I can use it as my mirror too. So you would ideally want to do this in front of a mirror so you can see. That will also help with the measurements. Okay, perfect. I got that one. So almost done. Now we're going to do thigh, right and left, and then we're going to end with the calf measurement. So the thigh measurement is actually the widest part of the thigh, not necessarily right in the middle, but it's going to be the widest part. So upper thigh. I'm doing my left side first. Crisscross. And then that's your measurement. Again, in inches. Now I'm going to do the right side. Here we go. It's a really sunny day. It's beautiful. Hopefully you can get outside today or sometime this week. All right. I should get the same exact measurement. Okay, and now we finish with the calf. So for the calf, this is actually the widest part of the calf. So not necessarily in the middle, but the widest part that you can eyeball. So it's sort of like the thigh. Okay. Got it. Now I'm going to do my right side. We'll be just about all set. You'll need a calculator or your phone for the next part. I'm going to calculate our waist to hip ratio. Okay, perfect. So done with the measurements. All right. So now with your calculator or phone, I don't actually have a calculator. I know it's embarrassing. We're going to calculate our waist to hip ratio. You're going to take the waist measurement, so that number, and you're going to divide it by the hip measurement in inches. So the waist number divided by hips. Okay, and this number is ideally less than 1. I'll tell you why in a second. So make sure, write that down. Waist to hip ratio, WHR. Okay, so ideally less than 1 for men, 0.9 or less. For women, 0.85 or less. That's because if your number was 1, that means you have the exact same measurement of your waist and your hips. And it's not just for shape, okay? So it's not because we want to be an hourglass shape. I mean, you don't want to be a box for a number of reasons. So if that number is 1, or if it's more than 1, especially if that waist is more than your hips, that could be an indicator of fatty tissue, extra fat that really shouldn't be there. And really the main reason for that is because the extra fat, what we call adipose tissue, visceral fat, it just sits there at the belly. It actually causes stress on the heart. So not only does it make you feel heavy and maybe doesn't look that great, makes you feel uncomfortable, it's also really not good for your body and for your heart. So this is an indicator of potential cardiovascular disease, obesity, diabetes, being overweight. All of those other things can be associated with that. So that is why we do the waist to hip measurement. It doesn't matter what the numbers are. whether it's a really low waist measurement or really high, but the ratio of the waist to hips, it needs to be less than, recommendation is less than 1. All right, so those are all of our measurements. On site, we would normally also do skin fold measurements, but we can't do that here in quarantine. So measurements are great. Photos are also excellent as well. And that's it. So next time we're going to do more of those fitness tests. For cardiovascular endurance, we're going to do a 3-minute step test. For muscular strength and endurance, we're going to do a 1-minute push-up test and a 1-minute curl-up or sit-up test. And then our last component of fitness will be flexibility, and that will be a sit and reach. So join us next time in February for those. And if you did these measurements, be sure to email your coach for holiday holdout to give them your post assessments. And if you were not part of the program and you did this demo and you want some more information, you're not sure what those numbers mean, if they're good, if they're bad, please reach out to any of the FOHO staff members. We're here to help and we can let you know. All right, thank you. Bye.